when I was a medical student. In the clinic where I was working, patients were always given the same medication called haloperidol. It's an antipsychotic. I took it for 3 days just as a volunteer. And the most profound emotion for me when I was taking this medication was lack of any emotions. I wasn't feeling happy. I wasn't feeling sad either. It was a zero emotion day, I wrote on the diary. It made me really think we need to work in this area, bring new treatments, bring new therapies, bring new medications to solve the problem of psychosis. I am Lena Palaniyappan. I'm a professor of psychiatry at McGill University, and I direct the Center of Excellence in Youth Mental Health at Douglas Research Center.
It's extremely important for a researcher to be recognized by these kind of prizes.
It helps shine a light on this underserved area of research that serves a critical and urgent need in our society.
What we are facing right now is a tsunami of rising problems in mental health. Our youth are facing more and more mental health related issues and seeking help for that. When a young person starts getting some symptoms of mental health problems, the narrative that comes to their mind is one of fear. In fact, cascade of fear. The fear of what is going on, the fear of will I get some help, the fear of will I get better? The mission of my career is really to change the narrative around mental illnesses that start at a very young age.
In psychiatry, identifying mental illness very early is extremely important because it allows us to treat it before it starts. That's prevention, and that's the highest level of medical research if we can apply it. And I think we are, and Dr. Lena Palaniyappan is leading the way into this direction.
We try to foster a sense of community in our councils, but also at the center is really from a collaborative lens. We're always looking at how we can work together. Our youth and our loved ones and the people with lived experience fill a huge gap here at the center. They have a huge voice and a huge implication in the work that we do.
Having a lived experience coordinator there during each meeting is very important to feel safe and listened to, and important to feel that you're in a space where you're not being judged. And I feel like that's when people are more open to speak.
This is a participative research where people are engaged in research, are also asking the questions, are also involved in the design of research.
Quand on a monté le programme Bloom, qu'on appelle Éclos en français, ce qu'on veut, c'est intervenir avant qu'il soit trop tard, avant que le jeune aille mal.
This project was conceptualized and co-collaborated on by teens, youth, and loved one council. So they each had their role, from the recruitment materials down to the research assistants that collect the data. We really conceptualized the project like Bloom that centers on the experience of young people and their caregivers to make sure that we're moving in a direction that's authentic to their experiences.
I can see a future, I can see the growth perspective of being with Lena, because he pulls all the expertise from the different disciplinaries, and I always personally believe that solutions lies in between disciplines, and that's exactly what he creates.
We work very closely with people who build philosophy and theory around mental health problems. We also bring theoretical physics in it, neuroimaging in it, neuroscience and language and linguistics research in it. And we bring a lot of technology, especially at the moment. For example, we use an ultra high field scanner, a 7 Tesla scanner. We build the capacity to understand the uses of artificial intelligence in youth mental health space.
I think it's in the cutting edge of research in mental health.
One thing that's unique about the work that Dr. Palaniyappan is doing is that because our donors have been part of the journey with us, they've been part of the dream from the beginning.
Mental health research has been driven by researchers, our scientists who try to act as pilots of the aircraft, and people who actually suffer from mental health issues, the families and patients, are the passengers. That has completely shifted in the last few years, and now we have co-pilots who are actually people with experience, first-hand experience of mental health problems.
We have 3 lived experience advisory councils that really inform a lot of the work that we do, truly down to the wallpaper that lines the halls. I always say our youth, our loved ones, our teens, they're experts by their own experience, and they bring their own value and own knowledge to the table.
Most of the ideas that we convert to projects start from the lived experience of our partners, and they give a lot of input into the logistics and design of research projects. And every dissemination that we do, every part of outcomes and outputs that we get from research projects is disseminated through the input given by lived experience experts. It's not the destination that matters, the journey itself has to be safe, and these co-pilots really ensure that that's how it is done.